Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and MediSpa. Welcome to our Facebook Live event. Today, I wanted to discuss two topics. One is the importance of board certification for your doctor or surgeon, and the other is the importance of the consultation with your surgeon and some of the things that you might be able to do to prepare for your consultation. So, we always have conversations with patients about the importance of board certification. And I think there's still some confusion about what that really means. So as you progress through your medical training and you graduate from a medical school, you graduate with your medical degree. And then you have to sign on for a training program, which is your residency, and that can be in any subspecialty of medicine. In my case, I did 5 years of general surgery and then 3 more years of plastic surgery training. At the end of your residency training, then you're able to sit for a board certification if you so choose to. I think it's important that any doctor or surgeon want to sit for their board certification. So what that means is about a year after you finish your residency, you can start the process, which is a 2-stage process. The first is a written exam. And then once you successfully pass that, the following year, you can undergo a 2-day oral examination. And once you successfully pass that, then you become board certified. The board certification is good for 10 years, and then you have to recertify every 10 years after that. And that's usually just limited to a written exam. The reason I think it's important is that when you graduate from your training program, that's the last hurdle to go over. And that means that your surgeon or doctor that is board certified in their specialty has really gone through rigorous testing by the experts in their field. In my case, it was plastic surgery. So going through that process really separates the elite from everybody else. And so I think it's important that everybody have that.
What certifications do you currently have, and how often are those credentials renewed?
So I have currently am active in the American Board of Plastic Surgery, so I'm board certified in that subspecialty. I did recertify in 2013, and we'll have to do it again in 2023. I'm also a member of the American Academy of Surgeons, and that's another group or body that will test you and make sure that you're at the top of your field. That one you go through once and then you have that for life.
Do you feel that board certification will impact a patient's surgical journey more than someone who is not board certified?
I think that it can lend to patients' confidence that the surgeon that they chose has been really tested and has passed the highest degree of training and testing, so that they are at the peak of their group. And so I think it's important that somebody be with a person or with a surgeon who is board certified.
Segueing from that, can you describe your patient philosophy?
My philosophy that runs through the practice is that we take care of patients with the highest level of competence, the most up-to-date current surgical expertise, and with adequate care and compassion. We also really respect patients. And I think one of the things that we do that I really put a lot of pride into is education of the patient. And it's not just me, but all of my providers. I think we spend a lot of time educating patients about what they're talking about, what the most up-to-date treatment plans are, and how we would put those into practice.
What is a complementary cosmetic consultation, and how does this play into your philosophy?
We've chosen to do complementary consultations at the practice because I think it gives patients a chance to come in and at least talk about what's bothering them or something they've been thinking about for a long time. So I think it opens the door. We certainly don't have any obligations to anybody who comes in to discuss a topic or a possible procedure. I think this opens the door to have more people have access to a surgeon and to find out about plastic surgery. I think a lot of patients use the internet and social media. And I want to get away from that. I want to be available to patients to talk to them openly and face to face to give them the most accurate information.
What is the goal of you and the patient during a consultation?
I think the goal for both the surgeon and the patient is that we both find out about each other. It gives the patient an opportunity to interview the surgeon as well. It's not just the surgeon picking and choosing his patients, but it's also gives an opportunity to the patient to really find out if they bond with that surgeon. Is this somebody that they really feel close to and feel is confident enough to get them through to their end stage or their goal? So I think it's a critical time. I like to do the face-to-face consultations with patients. I think it has a better feel. I think sometimes when you do it virtually, and some of my colleagues are very comfortable with that, I'm more comfortable with seeing the patient face-to-face. There are techniques and parts of the surgery that I wanted to be able to describe to them in great detail. And I find that difficult to do over a network or in an email. And so this way I can really examine them. I can assess their skin tone, their texture tone. I can really get to know the patient. And I think it brings out a little bit more information being passed back and forth, because I think the patient has a chance to feel more comfortable in that setting.
Should the patient do anything prior to coming in for a consultation?
I think you really have to do your homework. And what I mean by that is, if you're thinking about a certain procedure and you've been thinking about it for a long time, that's when the internet is very helpful. You can look on the internet and find out what kind of surgeons are in your area, who are the experts, and you can actually go to their websites. And I think the thing that you really need to look at are patient reviews and also their photo gallery. Now, you also have to remember that the reviews especially are from a lot of different people, and they may have different ideas about what their outcome was. So you have to take that somewhat with a grain of salt, but the more reviews that you have on a physician that are positive, then most likely that person is very competent, and it might be somebody you want to have a consultation with. On the other hand, if a lot of their reviews are negative, then maybe you don't want to take the chance of having a consultation with that doctor. The same thing with the photo galleries. You have to remember that the patients that are on the photo gallery have given consent to be on that gallery. There are sometimes comments about patients that say, well, I would like to have a facelift with you, but you don't have a lot of patients on your photo gallery. You have to remember that sometimes facelifts, eyelid surgery, those are obviously of somebody's face and they may be recognized. So a lot of patients are just sort of reticent to have their photos on the website. So just because a physician doesn't have a lot of photographs doesn't necessarily mean that they don't do a lot of surgery.
Why is reviewing before and after photos so important to someone's surgical journey?
Well, I think it allows the patient to sort of identify with the patients that are on the website. And you might be able to find somebody who has a similar pre-surgical body habitus or problem that you're looking to correct. And you can see how that surgeon corrected the problem and then looking at the post-operative photos. And so it kind of gives you an idea of what the artistic feeling is by that doctor, and you might be okay with that. And if it's something that you like the outcome and you like most of the outcomes by that surgeon, then it's probably somebody you want to have a consultation with. If you look at those photographs and the post-op may not resonate with you very much, then it's probably somebody you don't want to have a consultation with.
What are the top questions you get during a consultation?
First and foremost, patients always worry about anesthesia. So I always talk to them about the place I do the surgery, and it's always in an accredited surgical facility, whether it's a hospital or a surgery center. I do the majority of my surgeries in a surgery center, but it's a quad ASF assessment. And so it's a very safe, clean place. It's assessed every single year. They have board certified anesthesiologists and certified nurse anesthetists. So I can assure them that the anesthesia taking care of them is at the highest of quality. And again, they are board certified just as I am. Another question is cost of the procedure. We have a patient care coordinator that goes through the cost of the procedures and every dollar is broken down so they can see what goes to the surgery center, what goes to anesthesia, and what goes to the surgeon. The last question I get get asked a lot is, what's my downtime? And that depends on the surgery that you're doing and also your job. Patients that are sitting at a computer or doing that kind of work, then maybe your downtime would be less than somebody who has an active job, such as moving things, lifting, pushing, working on an assembly line. Also the type of surgery. So you might have a smaller surgery, it gets you back to work sooner. So those are all things that you want to talk to your surgeon about, because that surgeon needs to individualize it, not only to the procedure you're having, but to also your job description. So one of the things I ask patients when they come in is, describe a typical day in your office setting. Are you working from home? Are you working at a computer? Are you lifting? That helps me assess when they can go back to work safely.
Does each consultation differ from patient to patient, and how do you cater to someone specifically?
Well, I think every consultation is different for every patient. So they have some type of problem that's been bothering them for a number of years. They have sometimes some preconceived ideas of what they want. And so I have to go through that individually and how it affects that person. Just because you do one surgery over and over again, you have to individualize it due to different body habitus. Sometimes patients have some asymmetry, some bony defects. The skin at different ages is different. So everybody is a little bit different depending upon what they bring to the table.
What is the next step following research and a consultation?
I think once you've done your research and you sat with the surgeon or multiple surgeons, if you do multiple consultations, I think at that point you have to decide if you're ready to have the surgery. And then the next thing is when do you want to have it? And really it depends on your timing. And patients ask me, what's the best time to do this? And my response is always, when is best for you. So when you have time where you have a week or 2 weeks that you can give for downtime, that's the best time to do it. It's not really up to the surgeon's schedule, but really the patient's schedule. So I think that's important. And also, who's the surgeon going to be? You have to be able to pick somebody that you feel comfortable with. You want to pick somebody that you feel like you can ask questions. They relate to you. They explain it in such a way that you understand it. And that should be the surgeon you go with.
What is the biggest piece of advice you can give to someone looking to start their surgical journey? And is there any non-negotiables?
I think, again, just to talk about what we talked about before, is I think you have to do your homework. I mean, this is something you wanted to do. Sit down, spend some time, go through the internet and research the physicians in your area. And some of us do more one type of procedure than another. Go through that, write down 3 or 4 names that you might want to check out. Go to their websites, look at their reviews, see what their patients are saying about them. Look at their photographs, call the staff, call in and find out how friendly the staff are. How helpful are they? You know, are they educating you from the first time that you call in? Do you have a warm feeling about that person that you're talking to? And then I think, you know, the next step is the consultation. How do you feel in the consultation? How were you addressed properly when you came through the door? Do you feel comfortable in that environment? How was your meeting with the surgeon? Do you feel comfortable with the patient care coordinator after you meet with the surgeon? I mean, these are all important things that you have to decide, is this right for you? So I think that part of the journey, I would recommend going through all of that. Remember, at the end of the day, there's no obligations. You don't have to choose that surgeon, that practice. You don't even have to do the surgery. So it's really, you have all the control. And the nice thing is you'll be able to at least come in and find out real information about something that you are thinking about doing, something that's bothered you, or something that you wanted to correct for a number of years. I hope this was helpful, and I thank you everybody that have watched. And if you have any other questions, please let us know. You know how to get a hold of us, and I will see you next month at our next Facebook Live.